Nursing is the largest healthcare profession in the United States, and through its nursing initiative, the Gordon and Betty Moore Foundation has worked to ensure that nurses have the clinical and leadership skills needed for their roles today and in the future.
Nursing is, as is all of healthcare, undergoing a shift in expectations of the role of the nurse.
I see nurses as the front lines of public health. Who are the people that have the credible voices? If you look at nursing, it's the most trusted profession.
As we move forward into the 21st century, the kind of work that you traditionally think of a nurse doing is shifting dramatically.
By training nursing students and new graduates as scientists, teachers, and leaders, the Betty Irene Moore Nursing Initiative strive to ease the nursing shortage in the San Francisco Bay Area by addressing barriers to enrollment in nursing schools and to better prepare nurses to provide high-quality patient care.
The nursing shortage in 2001 was severe across the country, and it was of concern to everyone in the profession.
We needed an accelerated doctorate because there weren't enough doctorates in order to be the professors that would prepare the nurses.
We designed a program with the Moore Foundation to help nurses get through the doctoral program without the kind of competing concerns of having to work full-time. So there was a generous stipend and a commitment to completing the program in 3 years.
It wasn't until I got the information about the Betty Irene Moore grant that I thought, 3 years? I'd never heard of anyone doing a PhD in 3 years, and I wouldn't have to work, and I could still put food on the table for my daughter.
The accelerated doctoral program was clearly designed for those people who wanted to take a faculty position at graduation, helping nurses who had come from clinical practice learn how to educate that next generation.
I am making an impact on a much broader scale because all those students become nurses and they take care of multiple patients.
The structure of the Moore program, I think, was a really very innovative idea at the time. As soon as it started, our pool of applicants doubled. When the program finished, over 90% had completed on time and had taken faculty positions. People from the Moore program have gone on to become assistant professors at Tier 1 universities. As I look at the national programs that have developed since then, I think the Moore accelerated doctoral program had a tremendous influence on universities across the nation.
If it weren't for the Betty Irene Moore initiative and the grant that I received, I would still probably be teaching 2 days a week as an adjunct instructor and being in the hospital. And while that would still be a great life, it wouldn't have the impact that I'm having now.
As a result of this program, plus others supported by the Nursing Initiative, 238 new nursing faculty and clinical adjunct faculty taught in San Francisco Bay Area schools of nursing. These new faculty and other Moore Foundation efforts led to 1,050 new registered nurses within 5 years. The Betty Irene Moore Nursing Initiative also enhanced pre-licensure curriculum to better align with patient care needs by integrating the quality and safety education for nursing competencies into nursing schools.
We have integrated the QSIN competencies and the KSAs into every single course so that we can be sure our curriculum and our experiences prepare students for those roles.
All 6 of them are disposed throughout our clinical experiences, our simulation experiences, even our coursework. Each single one kind of ties together and it ensures that we provide optimal patient-centered care. It's like a checklist that we can think about before we walk in. I'm going to establish a rapport with them to make sure that I'm providing patient-centered care. I'm going to look at my teamwork and my collaboration. I think about informatics, how am I going to get the information that I need? So by following the QSIN principles, we're able to really make sure that we tie in all of the school nursing, that we really want to keep that strong foundation of nursing practice, but be able to do it in a way that is able to be implemented within the clinical setting.
Everyone recognizes that there are far too many errors and incidents that occur with patients with a focus of all practitioners on quality and safety, hopefully we can reduce the number of errors and incidents that are harming patients and really focus on helping them.
With the changes in curriculum, 1,700 nurses graduate each year in the San Francisco Bay Area with enhanced training in patient quality and safety. Transition to Practice programs are school-based partnerships with healthcare institutions designed to bridge the gap for new nurses between academic preparation and practice.
It's a huge shift that day you graduate and pass your boards to now be the responsible nurse. A Transition to Practice program is usually about 16 weeks of precepted experience with a one-on-one clinical opportunity with a nurse in a designated clinical setting. And during that time, they get to develop their critical thinking skills and really take on the role of a professional nurse.
I applied to the Transition to Practice program because I was interested in ambulatory care. It meant really getting the experience, additional training, really getting a better feel of what a day-to-day nurse in that field would do.
We all know that healthcare is moving into ambulatory care, it's moving out of the hospital. Our program has really focused on ambulatory care settings, non-traditional settings, schools, hospice, home health, clinics, transitional care.
USF had reached out to San Francisco General Hospital to see if there were clinic managers that were willing to take on students to be part of this transition program. We really make sure that they understand and fully grasp what their role would be here while they're here. We first ask them to observe their preceptor, and then from there we transition to watching them do it, and then we give feedback. The goal is to try to get the participants to work autonomously and then to seek out help if needed.
I was able to learn here at the urgent care clinic with a preceptor because you have that one-on-one coaching and teaching. It's nice to have kind of that little safety net while you're training, to be able to have a one-on-one preceptor that you may not have at whatever your next job is going to be.
Our work has provided an alternate to costly employer-based residencies, but recognizing that the residency idea or the precepted transitional experiences are essential.
Across 4 pilot Transition to Practice programs in the San Francisco Bay Area, 345 participants increased competence and confidence. In addition, 84% found employment 3 months post-program, compared to the statewide average of 57%. Through multiple approaches, the Moore Foundation is strengthening the nursing workforce to improve outcomes for patients in the hospital and beyond.
With health reform, we've moved to population health. Well, that means we need to train nurses differently than we have before, or put more of an emphasis on the kinds of trainings that we have provided. That takes a different kind of education than I think what we were delivering many years ago.
The Betty Irene Moore Nursing Initiative worked with 100% of the schools of nursing in the San Francisco Bay Area that offer pre-licensure degrees to strengthen the nursing workforce, training nursing students to be scientists, teachers, and leaders. Expanding the impact of this work beyond the San Francisco Bay Area, the Betty Irene Moore School of Nursing at the University of California, Davis will continue to drive this vision by preparing nurses to lead within their teams, organizations, and communities.